I'm fourth year PhD student at the University of Miami School of Medicine, getting my epidemiology PhD, and my focus is stroke and cardiovascular disease focused. So my journey in research, I started in the summer after my freshman year in undergrad doing basically ecological research. I started as an environmental science major, so I took many biology classes. From these classes, I developed more of an interest towards human biology, which then transformed into an interest in public health. And I later worked as an undergrad research assistant on a project that looked at medication adherence in elderly African Americans. And so from that experience, I devoted my time to researching disparities related to cardiovascular disease and stroke treatment and outcomes. And so as those diseases, they're very close to me because it has a huge impact on my family as well as people in my community. Before stroke patients are released from the hospital, healthcare providers, they educate and guide their patients with information on how to improve their diet, how to stop tobacco use and excessive alcohol consumption if that's applicable to them. And they usually have a follow-up medical appointment scheduled to check on their health status at a later time. So my research studies how these patients report and perceive this information provided at discharge. Was it sufficient or not? And then I examine the impact of this education and guidance on two outcomes. The first one being the patient's ability to improve their health behaviors a month after they're released from the hospital. And the second is death, rehospitalization, or emergency room visits 3 months after they're released from the hospital. Because racial ethnic disparities in post-stroke outcomes are common in the United States, I also observe these associations by race ethnicity. So this research, it helps to develop a better understanding of how the education and guidance provided before hospital discharge can create an effective hospital to home transition process for these stroke patients. The Foundation's award provides me with the platform and the tools to better articulate my epidemiological research to a wider range of audiences. This includes a public audience as well as people in other scientific disciplines. I plan on going to different conferences to present my research this year, and the support that this research or that this award provides allows me to reach and communicate to those audiences and expand my network, which will ultimately help me advance my career, my research career post PhD. Yeah, so I'm interested in teaching epidemiology and then continuing research related to stroke and cerebral vascular disease and cardiovascular disease, and looking at the health disparities, looking at health outcomes research. So I do want to continue to research and then teach as well. I would tell them to have confidence in the research they're doing, even if it sounds crazy. Maybe if you're like pushing towards it internally, like go for it and use every opportunity to communicate your research as well as your research interest to different audiences and explain why it can be impactful. Communication is key because I mean with our research there's so many different layers and components to the research, and you can go into different areas of the different parts of your research and different steps, but it's all about just how you communicate it to different audiences and how they can understand it and what they might find something interesting that you didn't even think about in your research.